For this video, I wanted to answer a question that's very common. The question is, I have chronic pain. Why do you keep insisting I exercise? And so we get a lot of folks in our office who have a long history of pain, 3 months or more, 6 months or more, sometimes years. And because the pain is the central piece of why they came in, a lot of folks expect us to just get rid of the pain using our hands, so massage therapy, manual therapy, or using different modalities that we have, like electrical stim or ultrasound or laser therapy. And those are all good. Those are all good things, and we use that quite a bit. But the main goal is to get you to exercise and move. Okay, so that I call that the main course. All the manual therapy, all the things that we do for reducing pain is really kind of the appetizer to get you to move so that you can move better when you're here with us. I'm here with Chloe, and I wanted to just talk about that a little bit from a physical therapist point of view, why exercise is so important, and then talk to you a little bit more about kind of the neuroscience behind it.
Yeah, so exercise has a ton of benefits physically and mentally and psychologically. Basically speaking, exercise can help improve your strength, flexibility, overall mobility, which all helps with making activities of daily life much easier to bear. It also impacts our psychological and mental health. So with the endorphin rush that you get from exercise, it makes you a lot happier after you exercise. It can also help to reduce stress, especially during this time right now that everybody's a bit stressed because of the pandemic. So there's many benefits of exercise as far as physical health goes and mental as well. And back to physical health, it can help with cardiovascular impact as well. So it's good for heart health and lung health as well.
I think most people can at least identify that exercise is good for you. I don't think I've never talked to anyone who said exercise is not good for you. And what we do is try to pick out the right exercises for your situation. I want to talk a little bit about the neuroscience of it. So what happens from a neurologic or from a brain perspective of when we exercise? What happens is when we're in pain, chronic pain in particular, we develop something called fear avoidance. Okay, which means we don't want to move when it hurts. Okay, now a lot of times that movement might hurt, but it's not really actually bad for you. Okay, it just may trigger a pain experience. So if you've seen my previous videos on pain, you know that pain is an experience. Okay, pain is our alarm system saying there's a threatening piece of metal in my leg or on my foot, or there's tissue being damaged, or something's happening, right? However, when we're in chronic pain, that alarm system stays very, very sensitized, very high. What happens is when you actually move that area, let's say it's my shoulder, and we move it or exercise it, the alarm system does this beautiful thing where it starts to decrease in sensitivity. We decrease the alarm system so that when we start to do this, at first it hurts, and then over time it doesn't, okay? So we decrease the alarm system in the shoulder area in general. So that's a great thing for it. So that's why we prescribe a lot of exercises. And you want to gradually do it. You don't want to just start lifting heavy weights. We gradually or grade your exercise. Another thing that happens is from a brain perspective, we have in our brain something called a sensory cortex, an area of our brain that senses all of our body parts. And there's a part of that brain that's related to the shoulder. And so what happens is when you start moving the shoulder, neurons for that particular area decrease or they quiet down. So that's another great thing that we want to do is stimulate movement, stimulate exercise to decrease the alarm system to the area. All that to say is exercise or movement is medicine. We want to use that as our main piece, and so we are always trying to push our patients to move and exercise. So for those of you who asked that question, I have chronic pain, can't you just make me feel good? We are doing you a huge disservice by just massaging you or just doing modalities and making you feel good for an hour or so, and then your pain returns. The exercise is going to have the more lasting effect. The modalities that we use, the manual therapy that we use, is so that you can exercise and move better. And that's going to get you the long-lasting effects that we're looking for. So that's a good question. We get it all the time. People have fear avoidance. They don't want to do anything that hurts them, but actually that's not good for you. You want to move into those things. I hope this one helps you, and we'll see you next time.